Tony was shocked to realize that the old doctor had accidentally pressed on the child's airway during an emergency rescue. He rushed forward and pointed out the mistake, but the doctor, seeing it was just a young man speaking, ignored him. Then Tony calmly explained, if the patient were an adult, the position would be fine, but since it was a child, the hand should be placed slightly higher, otherwise it would block the airway. Without waiting for approval, Tony gently adjusted the doctor's hand position, and then placed his own hand on the child's chest. With just one touch, he diagnosed a ruptured lung. Air was already leaking into the chest cavity, and without immediate intervention, the child's life would be in danger. The mother was instantly terrified, and begged Tony to save her son, but Tony simply turned and walked away from the crowd. He entered a nearby convenience store, and quickly mapped out a surgical plan in his mind. Using strong liquor for disinfection, he crafted a basic one-way valve using everyday materials. Once everything was ready, he picked up a utility knife. Realizing what he was about to do, the old doctor was stunned. The mother hesitated, asking if there was any other way. Tony replied calmly, the ambulance would arrive in 15 minutes, but the child had only 2 minutes left. The mother stopped hesitating, and gave him the go-ahead. Tony cut into the chest, inserted the makeshift valve, and within seconds, the trapped air began to release. Tony finally exhaled in relief. The old doctor, who had witnessed the entire process, was stunned. He immediately realized Tony was a true genius. He used all his connections to try and recruit Tony to his hospital. What he didn't know was that Tony was already on his way to interview there that day, but because Tony arrived 10 minutes late, the department head dismissed him on the spot, saying their hospital didn't need doctors who couldn't manage time, then turned around and left. Tony didn't give up, and continued introducing himself. But when the head learned Tony had autism, he returned, not to give him a chance, but to mock him, saying someone who couldn't even hold a normal conversation dared to dream of becoming a doctor. He threw Tony's resume on the floor, and left him speechless. Just then, a commotion erupted at the hospital entrance. The department head rushed out. A family member explained that their father had been having chest pain since morning, but thought it was nothing, until things got worse half an hour ago. Seeing the patient's pale lips and rapid breathing, Tony instantly diagnosed acute myocardial infarction, and stepped forward to explain, but the department head dismissed him, saying Tony was making baseless assumptions, and that a proper diagnosis needed an ECG. He reassured the patient's son that everything was likely fine, but procedures still had to be followed. Tony quietly repeated, "There's no time." But the family, convinced by the head's confidence, thought Tony was deliberately interfering, and one of them warned him to shut up. Tony blurted out that without immediate treatment, the man had only 40 minutes to live. Enraged, the son punched him to the ground. The patient was sent for an ECG, and the results came back. The department head confidently said it was nothing serious, just minor discomfort, and the man could be discharged after a bit of rest. The patient happily urged his son to complete the discharge paperwork, but just as they were getting into a taxi, Tony suddenly rushed forward and blocked the car. Furious, the son yelled at him to get out of the way, but Tony insisted that within minutes, his father would suffer a major cardiac episode. The son didn't believe him, and tried to walk away. Tony grabbed his arm, and during their struggle, the patient's breathing began to worsen rapidly.